All right, gentlemen, and anyone who may just be listening to this week's episode, we're going to talk about a topic that is filled with half-truths, filled with some lies, more importantly, a lot of misinformation that seems to just get repeated over and over again. And hopefully after this episode, right, you won't do it anymore, right? Because that's why you follow the show, right? Or subscribe to the podcast, right? Shout out to you guys. So we're going to talk about male fertility because I know you heard things like, oh, real men don't have fertility issues. Age doesn't matter. Oh, I can't wear tight underwear. You've just heard some silly things associated with male fertility because a lot of times when we talk about fertility, all of the responsibility is put on the woman, right? Like if a woman can't conceive, it's always the women's issue, right? Like, all right, what can the women not do? But like we're turning that camera around and saying, hey, what is it with men? What are the fertility issues associated with men? More importantly, hopefully we can dispel some half-truths today that are associated with male fertility. Because again, if you understand that fertility is a two-way street, you understand that it could be a male issue or a female issue, guess what? You get to the problems and get to the problem solving a lot quicker. So stay tuned for another amazing episode. Today we're talking about male fertility. All right, so we're going to talk about some myths that we want to debunk right off the bat. First of all, that age does not matter. For those who may not know or may not be aware, you may have heard stories about, sperm, is lifelong. I keep reproducing sperm, so it doesn't really matter my age. I'm good to go. It's not my fault. And that is totally not the truth, right? We know that as we age, not only can our sperm count decrease, but more importantly, and I think this is the factor, more importantly, we don't have as healthy a sperm as we had maybe when we were 18 or 20. So understanding that, your body may still produce sperm, and I'm talking about the folks who do, because there's a lot of older men, right, who you realize, oh, you're not producing sperm, and that may be for medical reasons, they take testosterone and some other stuff, but you may not even producing a significant amount of sperm versus your counterparts, right? So we're assuming all things are equal. It doesn't mean that the sperm you're producing is actually good sperm. So understanding that your age does play a factor when you're dealing with fertility and trying to conceive and have a baby, that if your sperm isn't good or you're not making enough sperm, that can be a problem in and of itself. And we can have different conversations on why you may have that. I'm pretty sure I have a blog or two that kind of focuses on that. But more importantly, I just want to kind of get us the idea and get that myth out of our head that your age does not matter. All right, and this is one myth that I'm hoping that by the time you're finished, watching this episode, you don't even think about it again, right? A lot of times we put the blame on women in our fertility issues, and I kind of mentioned it in the intro, but 40 to 50% of cases associated with infertility or fertility related issues are due to the men. 40 to 50%. So now that you know that we are responsible for about half the reason why there's fertility related issues, why do we always look at the women as the women are the problem? You just do a quick little search and you'd be surprised how many interventions and how many things are in attention is pointed towards the woman, when a lot of times it's the dude in the room. It's the dude who's on the side who is listening to, the doctor ask questions, who really needs to be answering some questions himself. And let me assure you, most docs, if you're having fertility issues, they're testing the guy, right? Because they know the numbers. They say, hey, you know what? I got a 50% chance that I don't really have to do anything with this beautiful woman right here, and it's all this guy over here. Guess what? Let me go wipe that out. And question is why, and I kind of mentioned it earlier, right? With the issue with your sperm, low sperm count, bad looking sperm, bad forming sperm, all of these issues here that the men are centrally so deal with, that typically, again, that responsibility always falls to the women. But no, if you're having some issues, you're having some concerns, especially if you're following this and you may be having some concerns about fertility and conceiving a child, understand that hey, guy, you may be the problem. All right, and this is another factor that I'm hoping that after this episode, maybe Fruit of the Loom or somebody will, sponsor a show or something, right? Having tight underwear is not the reason why you're having fertility issues, guy, sir. That's not the issue. In fact, if I had to point to some issues that are likely associated to you having fertility issues, your underwear or the tightness of your underwear is low, right? There is smoking, there's alcohol, there is exercise related issues, weight issues, dietary issues. There are so many different reasons why your sperm count may be an issue, or your sperm in general may be an issue, that you wearing tight underwear, again, Fruit of the Loom, if you want to sponsor me, let me know, is not the issue, right? Like, your tight underwear is not the problem, right? It's your exercise, right? It's your diet, it's your genetics, it's all your alcohol intake, your cigarette smoking. Why people smoke cigarettes, I don't know. Like, those are the factors that I'm lining up when I'm thinking about, hey, there may be a problem with your sperm that I think you need to solve, right? No, we're not checking, and I can assure you, none of our questions are typically centered around, oh, I wonder if you wear boxers or briefs. So let's talk about the impact of your lifestyle associated with fertility, right? Because there's some things you can't change. Your genetics is a big one, right? You really can't change your genetics. If there's genetic related issues, if there's an injury related issue while you're having fertility issues, all right, those are things you can't really necessarily modify. Maybe you can avoid injury if you could. But there are some things that we can change, right? And I kind of mentioned, right? Like, from a dietary perspective, we know that there's certain diets that seem to favor better fertility rates than others, right? More importantly, like the antioxidant diet, right? Again, I'll put some information on the antioxidant diet if you want. It'll be in the show notes, but don't hold your breath. If you have an antioxidant diet, you'll be free, right? But understanding that regular health exercise, decreasing your stress level, there are some modifying factors that we know can play a role in helping improve your fertility rates. Like, I think can be much more beneficial, and it can, like I said, just overall dietary issues, exercise, stress management. These are some of the things where when we're trying to figure out, like, hey, all right, you have some fertility issues, what are some options that we have in front of you, right, that you can kind of enact to kind of help those fertility issues. These are like three of the ones that I always like will pop up and kind of explain to my patient that I think you should be doing. Last but not least, associated with kind of the role of just kind of what your lifestyle is like as far as helping fertility, making sure you are getting regular checkups. You hear me? Right? Making sure that you're actually going to the doctor, doing your physical, doing your yearly or, biannual exams and getting lab work and all these things here, because there's diabetes, there's hypertension, there's all these other medical issues that can play a role. I tell you all the time, a lot of times in my office, the main reason why, I don't want to say main, but a big reason why men will come to see you in the office, right, is a family member said, hey, you better go, or like, I'm going to push you in there, right? Like, so some type of loved one pushing them to the doctor's office, or sexual dysfunction, right? And a lot of these things we could possibly catch early, deal with early, but we can't catch it early if you don't come to see us, right? So understanding that regular checkups need to be in your armamentarium if you want to make sure you don't have to worry about fertility issues when you're ready to fertilize, right? Think about that. Gotta have your regular checkups, right? We gotta do lab work. We gotta check your labs. Make sure you're not diabetic, high cholesterol, all these other factors. Make sure you're eating well, you're dieting right, you're exercising, making sure you're doing all these little things here that add up to big results, especially when it's time to kind of matter in the role of fertility, because again, it is a two-way street. All right, so let's talk about the role of some interventions, right? Like, you get to the point where, you know what, you are in that 40 to 50% range of the reason why, as a couple, you guys are having fertility issues. So what do we do? What options do we have? The most common that we know of, right, is kind of testosterone supplements or replacement, right? Because when we have hormone imbalances, again, that affects sperm production, that affects how well the sperm look, how well they work. If you got good swimmers, you got to make sure your hormone balance is intact, right? Again, but that doesn't happen if you don't get your regular checkups, right? So again, all of these things kind of build up each other, right? Again, I don't want you to have the regular checkup just to randomly have it. I want you to have it because I know if you have a good regular checkup, there's some things we probably can catch earlier, making sure you're avoiding medications, making sure you avoid certain activities that may be affecting your sperm related issues that down the line it's much easier to treat, right? So definitely testosterone supplementation or replacement. A lot of people are familiar with vitro fertilization. There's one, and I want to make sure I get this correctly. Intracytoplasmic sperm injection is another option for fertility related issues, especially on the men's side. So we got options, y'all. One thing I always say in medicine, if you come to us early enough, we have some options to treat the issue. You just got to come and see us. So there's definitely options And yes, there are risk factors associated with either option. I put a blog post on like testosterone supplementation so you guys can have an idea on. If not, I'll work on one from that standpoint if I don't already have one done for you guys. But like, understand that yes, there are some options out here for the men, right, when we're talking about fertilization and fertilization issues, because again, it is not a woman's issue. Fertility issues is not a woman's issue. Like, we got a 50% chance that it's likely the men at fault, right? Like, imagine that 50% of the time, like, we are the problem associated with fertility issues. Most docs, when you're going to deal with fertility issues, they're gonna check the man. Like, there's no way they're doing full-blown workups strictly on one side, especially when they got a 50% chance to work on the other, especially because a lot of like the tests on the men's side is a lot quicker, and we get a quicker results to know, like, all right, sperm counts, sperm morphology looks good. All right, we can go to the women, right? So understand testosterone levels, we can go to the women if all those things got to check out. So understand, yes, we do have options for you when you start having issues and difficulty conceiving, and it's found out during the workup that it is your fault. So never fear, right? You just got to come to see us to make sure that when it is time to understand, like, hey, I'm at the point that I need help, I need support, I need services, the medical field is here for you. Your partner will be there for you as well too, right? So it's kind of a team effort, right, in working with fertility. And I'm hoping after this episode, you kind of understand that when we talk about fertility and fertility related issues in general, like, men need to understand, hey, I may be the problem. And a lot of times it may be easier to solve the problem with me if I just do certain things to make sure that I'm in the best, fertility shape, if that's not really a term, but the best fertility shape that I can be for my partner. So again, I am yours truly, Dr. Bayer Pierre. Today we talked about male fertility. Hope you got a lot of that. I'm gonna see you guys next week.